Hi, we've created this video to go over the different types of birth control that are available to you. This will just be a brief summary, so please watch it prior to your appointment so that if you have any questions, the provider can discuss that with you during the appointment. We're going to start with condoms. This is probably the most readily available birth control option. You don't need a prescription, you don't need a doctor's appointment. You can get it pretty much anywhere. Gas stations, grocery stores, pharmacies. They do have an expiration date, so just make sure to check the expiration date on all condoms. If there is any physical damage done to the package as well, please make sure to not use that condom. They are a one and done thing as well, so one active intercourse per condom. After that, just throw each condom away. If you do have more than one active intercourse in a day, please use a new condom for each time. Something similar that's used every time you have intercourse would be a diaphragm. This is a flexible dish-like structure. You apply spermicide within the inside. It's going to sit right against your cervix. So if this was my cervix, and then the vaginal canal would be here. You do need to insert it for at least half an hour prior to intercourse and then leave it for up to 6 hours after intercourse to make sure that you prevent any undesired pregnancies. Something that is kind of similar, it's hormone-free, it doesn't need to be inserted though up to half an hour before intercourse, is kind of new. It's called Phexxi. So it's a Vaseline-like gel that comes in this tampon-like applicator. You would insert about this much or the entire tube of the gel into the vagina at least at least 1 minute before intercourse. It can be inserted up to 1 hour prior to intercourse. If it's any longer than an hour, you will want to use a new Phexxi tube though as well. If you happen to have more than one active intercourse in the hour time frame, you would want to use an additional one. It's essentially one act, one applicator. So make sure that you're using that. This is newer, so insurance coverage may be not as great. That would be something you'd want to contact your insurance with and discuss with that as well. Something else, so then we're kind of going to be moving on to our daily birth controls. Most common that you've probably heard of is birth control pills. They all kind of follow the same consistency. So this is the right-hand side of the pack, and you would just follow row by row through the pack. In this pack, the last 4 pills are the placebo pills. So that's when there's no hormones in it whatsoever at all. That's typically when you would have your period. Some people will start their periods on the very first day of the placebo pills, some not until the last, some in between. That's okay. Continue taking the pills day by day. It doesn't necessarily matter where your period starts. Even if your period starts on this day, the next day you're going to head just right next to the next pack. We know accidents happen. Birth control pills do need to be taken at the same time each day or as close to as you can. We typically say aim for about an hour window. That time frame can be in the morning, afternoon, or evening, whenever works best for you. Say you wake up really early for work during the work days, but you like to sleep in for the weekends. I wouldn't necessarily do birth control as the first thing that you do when you wake up then, as you may miss that time frame on the weekends. You can also take it at night if you tend to go to bed around the same time. But say an accident happens. Say I take my pills every day at 8 a.m. and by noon I realize I forgot this pill. At noon I'm just going to take the pill, and then the next day at 8 a.m. I'll continue going back to the next pills. If I wake up this day and realize I forgot the one from the day before, I'm going to take them both at the same time, and then the next day I'll go back to just doing 1 pill a day. In either of those instances, if I take it late or if I miss a pill, I am going to want to use a backup method for at least 1 week to ensure no undesired pregnancy. If the pill that I miss is in this very first week of the pack, I'm going to want to use a backup method such as condoms for the entire pack until I have my period, and then I'll go back to using birth control like normal. Another option that's similar to that but isn't done daily is the birth control patch. So this is a patch that just wants to be applied to like a large area. Some people will do it on their arms or on their stomach. You apply it weekly, so some people will just switch it every Sunday or just consistently from weekday to weekday. You apply it for 3 weeks, and then you would leave off a patch for 1 week. That would typically be when your period is at, or kind of like the placebo window of this. At the end of that week, you apply a new birth control patch. Another option that's similar to that is the Nuva ring. So this is a flexible ring that's inserted to the vagina or just where you would insert a tampon. You leave the ring in for 3 weeks and then remove the ring for 1 week. That 1 week is typically when you'll have your period. You are still protected against undesired pregnancy during that time frame, but you would, at the end of that 1 week, you would want to reinsert a new NuvaRing. So each month you would be getting a new prescription. Something that's newer, where each month you don't need a new prescription, is Annovera. So again, flexible. It is a little bit thicker in size, but it's just going to sit right in the vaginal canal. So if I have this diaphragm, this is the vagina, this is your cervix, and this is your uterus. So it's going to kind of sit just up towards the end of the vagina, right up towards the cervix. You leave it in for 3 weeks. You remove it for 1 week, just like the NuvaRing. It does typically come with a case where at the end of the 1 week, you can just insert it into the case, close it, forget about it until the next week. Once you've had it out for a week, you would reinsert it after that. Then we get into kind of our more long-term options, which one of them would be the Depo-Provera shot, which is a progesterone-only shot. It's once every 3 months or every 12 to 13 weeks. That is something that if you feel comfortable, you can do on your own, but we do typically advise that you come into the office to have this given. It typically goes into your bum, so just be mindful of that. This one too, it can make your periods stop, and sometimes it can make your periods stop, like not return for up to 18 months after your last Depo shot. So be mindful of that if you're wanting to try and conceive soon. This may not be the option, as it can take up to 18 months for that progesterone to wear off. But it is nice because you only have to do it once every 3 months. And we'd get into even our more long-term options where you just insert them, they're one and done. That would include our IUDs. We offer currently 3 different IUDs in our office. So we have the Kyleena and the Mirena. They're both a progesterone IUD that are pretty similar. That progesterone is going to thin the uterine lining, which means over time, your periods may lessen or they may completely stop. Once that IUD is removed, your periods will return to normal, or your normal in that case. The Kyleena lasts for 5 years and the Mirena lasts for 7 years. The Kyleena is just a little bit smaller in size, so that one's typically recommended for our patients who have never had any prior pregnancies or who have only ever had like C-section births. Mirena is a little bit bigger in size. We typically advise that for our patients who have had prior pregnancies, but either one is perfectly fine for any of our patients. So you would want to discuss that in more detail with your provider. The other IUD option that we have is the copper IUD, otherwise known as the Paragard IUD. So it doesn't have any hormones in it whatsoever at all. The copper thickens cervical mucus, so sperm have a really hard time getting into the uterus, and then if any sperm do, the copper immobilizes the sperm, essentially making them ineffective. This one doesn't have the added benefit, though, of your periods slowing or stopping. So if you have really heavy periods, the other IUD options might be a better option. Some people say their periods even get heavier or they get a little more crampy. So that is something to be advised prior to doing this option. The downside on IUDs is any IUD, you're going to have some irregular bleeding after insertion. We typically say it could just be really spotty for 3 to 6 months. Your periods might last a little longer. So your periods right now last 4 days. They might last upwards of 7 days. It's all different for every single patient. So it is something to be mindful if you're getting married soon or things like that. Just be aware that you could have some bleeding after insertion. Another long-term option is the Nexplanon. So this is the rod that's inserted into the arm. It kind of just goes into this squishy part right here. It is a progesterone-only rod. It lasts for 3 years. Any long-term option, so Nexplanons or IUDs, can be removed before their time frame. Say you hate it, or you want to try and get pregnant, or you just want it removed. Please contact us. We'll schedule an appointment and we will get that removed for you. The Nexplanon, like I mentioned, lasts for 3 years, is progesterone only. It can also cause some irregular bleeding, so just be mindful of that, but it's less invasive than an IUD procedure as it's going into your arm rather than inside your uterus. There are still other birth control options out there, so if you're interested in any others, please just talk with the providers. The best option for you is going to be the one that you use most effectively, but we're here to answer any questions even after your appointment. Thank you.